Hello everyone. In this video, we're going to brief you with our work for the Data Science for Common Good program, where we spent our summer analyzing the influence of social determinants on COVID-19 indicators, mainly the vaccine uptakes in Massachusetts. Our team of three, Anushka, myself Disha, and Ian, are master student in computer science, and we performed the study under the guidance of Dr. Matthew Radigan, faculty in CICS at UMass. Our clients, the Department of Public Health in Massachusetts, are concerned with everything related to health for Mass residents. Currently, they're overseeing COVID-19 response, vaccinations, and reopening in Massachusetts. Now, what are some of the challenges that data science can help us solve with DPH, especially in response to the pandemic when there is no dearth of data available on COVID-19 indicators? We could be looking at what kind of demographic makeup of a region is influencing the infection rates or the vaccine rates. That also leads us to find similar regions in terms of demographics and possibly in terms of COVID too. Additionally, data science can help us find relationships between things like COVID death rates and the number of diabetes hospitalizations of an area.
The first tool that we are going to talk about is the ACS download tool. ACS or American Community Survey is the premier source of data for population and demographics in the country. At DPH, the team frequently has to manually look up, download, clean, and stitch together data from various tables in the ACS website. This process is obviously time-taking and prone to human error. To mitigate this, we created a tool that automates these very steps in very little time. The tool takes as input parameters like year, geographical unit, and survey type, and also a mapping between various features and their corresponding feature IDs on the ACS website. In turn, it spits out a merged report as an output. This report could easily be customized. For example, for a combination of parameters and features depending on the problem at hand. The next tool that we are going to talk about is the weekly vaccine data merging tool. DPH collects and publishes weekly reports on COVID-19 vaccine administration and distribution data in different groups based on their age, gender, and ethnicity. For example, vaccine uptake data for ages between 12 to 15, gender like male, female, or non-binary, and races like white, African American, or Hispanic. All this data is meticulously recorded in these reports. For a longitudinal analysis of the weekly vaccine data across the state of Massachusetts, we created a tool that directly downloads these reports from the DPH website, processes them, and merges them together into one big data set. This data set is particularly helpful for DPH for analyzing vaccine uptake trends and to leverage federal funds for communities where the vaccine uptake numbers are not that promising.
One form of analysis we used to better understand the data is clustering. Clustering is the process of breaking data points into groups based upon their similarities. In our project, we broke zip codes into their peer groups based upon their demographic similarities. The similarities included things like their racial makeup, their economic makeup, or employment types in that area. These peer groups can be extremely helpful for comparing zip codes to one another. It is often much easier and useful to compare a zip code just within its peer group rather than to the entire state. When clustering, there are many different options you can use. To allow DPH to explore these options, we've created an online clustering tool. They simply input the parameters they would like, and it outputs a given cluster. These parameters can include things like the number of clusters to output and the features they want to cluster by, such as just the economic features. To see how the clusters interact with the data we've collected, we've created a data dashboard. In the first graphic, we are showing a single peer group, and we can see how similar zip codes interact with one another. Another feature of this dashboard is selecting a single city, such as Boston, and see how the zip codes compare to one another from a single city. The box plot on the left can show the spread of a feature in the group selected, and the bottom graphic can show a health outcome over a period of time, such as COVID vaccination rate over a number of weeks. In the future, we'd like to expand this project to other health outcomes, not just COVID vaccination rate. There are many other things that this framework can help give meaningful insight to, both COVID outcomes and non-COVID outcomes. If you have any further questions, please contact us. Thank you for taking the time to watch our video.